Now let's move on to this next segment. So you see that right there, exercise for cancer prevention. So in case you needed one more reason to get out and exercise, here's a really good one. And we have a doctor joining us this morning, Dr. Thomas, who is joining us right now. Good morning to you from Scripps MD Anderson Cancer Center, Scripps Clinic physician. How are you doing, sir?
Fine, thank you. Thanks for having me this.
Yeah, we're glad to have you because this is an important new study that I think perks up a lot of ears. So exercise for cancer prevention. Of course, so many people hoping to prevent getting cancer. So tell us what this new study is. How much exercise are we talking about?
Well, this is an exciting new study because it starts to quantify the benefits of exercise with respect to prevention. For a while now that exercise is beneficial in preventing certain types of cancer. But this new study suggests that 300 minutes a week or 5 hours a day of moderate exercise can prevent almost 46,000 new cancer cases in the United States.
The audio is cutting out a little, doctor. I apologize. How many hours a day?
It could be an hour for 5 a week or 45 minutes, 7 days a week of moderate exercise.
Okay.
Will help to prevent a significant number of cancers.
Gotcha. So 5 hours a week is what you're saying. So, you know, when we're talking about activity and exercise for people who are at home right now, maybe they were like, man, I don't feel like doing it today. What should they think about? Obviously, you know, it doesn't mean you have to go run a marathon right now, right?
Exactly. I think you could develop this into a daily habit that becomes enjoyable. San Diego, it's got perfect weather and you're able to walk around and be outside. You could find a variety of things, whether it's going to the gym or biking or walking or just being outside and being active. I think it benefits you from a cardiovascular standpoint, from an obesity standpoint, and now we have clear evidence that it helps to prevent certain types of cancer.
And if you could explain, doctor, I know a lot of people like myself wonder why that is. I mean, we know obviously all the health benefits of exercise. It's very expansive, but how does it prevent cancer? Why is that?
Well, that's a great question. This study didn't specifically look at the mechanism by which it protects, but we know that exercise on a regular basis helps bolster our immune system or our body's defense system. These are the white blood cells like lymphocytes that can survey our body, and if a cancer does develop, it could help attack and prevent it from developing into malignancy. And that's probably one of the mechanisms by which exercise helps to beneficially prevent cancer.
Okay, so we want to make our bodies as healthy as we can. So what other things can we do? What other risk factors would be something that we can, in fact, control, like exercise?
Well, at Scripps Clinic, Scripps MD Anderson, we're all about cancer prevention. Obviously, cancer is a terrible word, and there are a number of things we can do to prevent cancer, such as sun safety practice, go outside wearing sunscreen. Most importantly, a non-smoker, I think we recognize that tobacco is a strong carcinogen for many types of cancer. We can vaccinate our adolescents and our children against particular viruses that are known to cause certain types of cancer. And then we could eat a healthy diet, prevent obesity. We are clear that we should also exercise. In addition, I think in addition to prevention, early detection is really important too. So seeing your primary care doctor, getting the recommended early detection, screening things like colonoscopy and mammography, these are all very important.
Yeah, especially, you know, right now it's obviously on the mind as the Susan G. Komen walk takes off for the 3-day walk. And many people know, you know, even if you follow all the rules and you eat healthy and you exercise and you get the proper sleep, it's still sometimes out of our hands, right? What other cancer risk factors are literally out of our control?
There are. I think the biggest risk factor for cancer is just increasing age. And I guess the good news is our life expectancy is increasing, and thereby our risk of getting cancer gets higher as we age. And there are other things like family history that we cannot control. So it's nice to have a new study like this that points to something that everybody can impact, right? Everybody has control over how much activity they have in their lives.
And Doctor, since we have you on and people are at home watching this on TV right now, what's a message that you want to get out to them? I know, with a lot of people, it's easy to maybe skip that, walk or jog. But, if they're considering maybe skipping it, what do you want to tell them?
Well, having cancer is not very fun. I think you could ask many people on the Komen Walk about their experiences. And of course, it's 100% survival from cancer if you never get it. Mm-hmm. And so do everything we can to maintain a healthy lifestyle. Again, please avoid tobacco and continue to educate our youth about the harms of tobacco. And I think they eat well, maintain a normal weight and exercise are really good strategies. Yeah.
And I like what you said. We live in San Diego where, every day is a really nice day to go out and work out. I mean, we have it right there just outside of our doors, this great weather that we get to enjoy. So make it fun.
Exactly. One last, yes. I would encourage people during this time of COVID to take care of themselves, but also to recognize that cancer screening is very important. You can go to Scripps Clinic, Scripps healthcare system, see a primary care doctor, and don't screening for fear of going into a facility. It's very quite.
Right. Yeah. The early detection, of course, is key as well. All right. Thank you very much for being on with this important information. Good to see you this morning.
Thank you.